Next, we've got Clare Morrison, Highland Pharmacy Project, one dear to my heart. Clare, on you go. Good to see you.
Thanks. Hi, so I'm here to talk about Pharmacy Anywhere, which is our new pharmacy project in Highland. NHS Highland is a remote and rural health board covering a large geographic area. From a pharmacy point of view, what that means for me is there are many dispensing GP practices. For those of you who don't know what a dispensing practice is, it's a GP practice that dispenses medicines without any pharmacy input. Now, they do a great job in getting the medicines to people, but we know that pharmacy input improves the safety and the efficacy of medicines use. So from a policy point of view, Prescription for Excellence, the National Pharmacy Strategy, and changes to legislation a couple of years ago said that NHS boards had to make sure that patients of dispensing practices had some pharmacist input. So we piloted a face-to-face service in 4 GP practices and showed that pharmacist input really made a difference. But our problem was, how on earth do we deliver this service across our massive geographical area? And so we turned to telehealth. So problems with our area are obviously things like recruitment of sufficient pharmacists across this big area. And then if we were to put people in cars and send them out, then they'd spend all their time travelling and not in their clinical role. So last year I was lucky enough to complete the Scottish Quality and Safety Fellowship, and as part of that you can go on a study trip, and I went to Intermountain Healthcare in the US to study their use of telehealth in a similarly rural area, and their service is called Connect Care. It's an unscheduled care service that reaches people directly in their own home, and the really interesting thing I found was that actually patients preferred it. It was their choice. They liked using telehealth as opposed to having to go and have an appointment. So I then applied and received Health Foundation funding for the Pharmacy Anywhere project in Highland. The Health Foundation is a charity committed to bringing about better health and care for people in the UK. So our project involves 3 dispensing practices. Each has a remotely located clinical pharmacist, and we're really replicating our face-to-face service. So patients are given an appointment, they have a medication review, the pharmacist is able to amend their medicines, prescribe new medicines for them, give them advice about their medicines, and really help them to take their medicines safely. We're using 2 forms of telehealth. We're using Attend Anywhere. We're one of the 11 boards that are using it so far. And in addition, we're using Vision Anywhere, which enables the pharmacist to access the patient's medical records remotely. These are the 3 fantastic pharmacists who are actually doing the job. So we've got Patricia, Lucy and Yvonne. And the process for the service is that the GP practice staff make the appointment for the patients just in the normal way that an appointment would be made. And the practice then sends the patients these information leaflets which explain the telehealth and explain the purpose of the appointment. If the patient doesn't have a computer or a smartphone or an ability to use telehealth, then we just offer them a standard telephone consultation instead. So at the time of the scheduled appointment, the patient then accesses our website, which is like this, and then they attend the appointment using Attend Anywhere. Meanwhile, at the other end, the pharmacist has a screen that's got 2 halves to it. On one half, they have the open video consultation that's got the Attend Anywhere screen on to consult with the patient, and on the other half, they've got their Vision Anywhere record, which shows the patient's medical record. So we received funding for this project in January this year. We got the systems up and running, the protocols in place, the practices recruited and the pharmacists recruited between January and March. We tested it with practice patients, which were mainly staff, in April, and then we're now live from the first week of May. We've got an evaluation going with external support from Robert Gordon University, and we're taking a quality improvement approach, so we are constantly improving. Our early learning so far has been mainly to do with changes to Vision Anywhere, especially around prescribing functions. And in terms of Attend Anywhere, we've had a few problems with patients not having a webcam but thinking that they had one, and being able to use the right browser. But overall, it's been a really positive start, and there has been huge interest locally from all sorts of different health professionals who want to replicate this for their own services. Thank you.